A very good morning to all joining the call today. Um, Today we are going to discuss a topic which is very important. We hear a lot about mental health, but there is still people are very unsure about the topic, and hence we want to just unpack mental health as the topic says. So we will be exploring the different themes, exploring what counseling is, what psychotherapy, psychology, and psychiatry are, and give you a basic understanding of each of these um, terms, as they say. And so we are part of Raahat. Raahat is a total person care wellness center, and our vision is to provide a place of comfort which is refreshing, regenerating, and restoring for the mind, body, soul, and spirit through whole person care. So we're really delighted to have you all in this call today. And the Raahat team is here. I'm Sharon Prasad. I'm a counselor and psychotherapist at Raahat from the Raahat team. And I have with me my colleague and my friend Sheethal here. Sheethal, you want to introduce yourself to the audience
Hello.
here? Yeah,
Hello, everyone. Thank you, Sharon, for inviting me.
my pleasure.
Uh, and for the entire team also, especially MD Dr. Vinita Matthew. Thank you for her to giving this opportunity. And yeah, this is Sheetal. I'm a clinical psychologist and a clinical hypnotherapist too. And I'm really excited to talk to you about this topic, which is very, very confusing to everyone.
Exactly. That is exactly why we're doing this today. Uh, because I remember we ourselves have had conversations about this, and we have our own team members from the hospital that we work in, Ashok and where people come to us and ask these doubts. We have even patients who come and have these doubts. We thought it's important to address these doubts. So we are going to have a conversation where we're going to address some common questions that have come to us personally, and we just want to talk on that
Yeah.
right now. Yes. Yeah. Okay. So yes, Sheetal, it's we actually happy that mental health, the awareness has gone, that has increased rapidly after COVID, of course. So the term mental health has become, I can say, popular in a way. Everyone is very
Yeah.
hyped up about therapy, mental health, and all of that. But still, for people who are still unaware or not very sure about it, Sheetal, do you wanna give them a basic understanding about what is exactly this mental health, and why is taking care of mental health so necessary? Can you shed light on that?
Yes, first of all, I want to take you one by one. Number one is this mental health refers to our feelings, our thoughts, emotions, and attitudes, and which these reflect into our behaviors. Essentially, it reflects in our emotional lifestyle, the way we react with the people, and overall our well-being, how we think and how we react in the real situations. So it is really necessary to take care because our mental health is connected with our physical health.
Mm-hmm.
This is why our emotions and thinking styles, we say that it shapes our behavior. So sometimes when we experiences disturbances or which like in real situations we react that we should not react in that situation actually. So this time not only our physical health but our relationships and everything get disturbed. So
Mm-hmm.
therefore I'd suggest everyone that if we want to make our physical health fit, then
Mm-hmm.
it is necessary to keep our mental health also in good shape. I'll give you a simple example. If suppose Sharon, अगर कोई दोस्त आके आपसे कहा कि
Mm-hmm.
देखो भाई मुझे एग्जाम की नाम सुनने से मुझे डर लगता है एंड
Yeah.
मुझे पॉटी आ जाती है समटाइम्स मुझे वॉमिट जैसे फीलिंग आ जाती है इंटरव्यू तक मैं अच्छे से प्रिपेयर हो जाता हूँ लेकिन जब इंटरव्यूअर अपना नाम लेते हैं, वो टाइम पे मुझे उल्टी जैसी फीलिंग आती है, हाथ पैर कांपते हैं। वाई? बिकॉज द कमांड इज गोइंग in psychological way and it is reacting in your physiological way. That's
Right.
why we say action. For every action there is a reaction. So
Yeah.
the action is happening in your head, but the
Mm-hmm.
reaction is happening in your physiological level. So
Mm-hmm.
to keep your physical health fit, so mental health is also necessary.
Right. Yeah. Thanks for sharing that. I think, yeah, we also, put up slogans in our hospital as well, where we say,
Yeah.
take care, mental health is as important as physical health. Right, right. I just want to take a moment to also welcome all the people who are joining us right now. Welcome to
Yes.
the session here. So we are talking about mental health. We are unpacking mental health, all the basic doubts you may have about mental health as to what is mental health. So Sheetal was just telling us about, what is mental health. It is the emotions, the behavior, the feelings that we have, and why taking care of mental health is important. So she was giving us an example of how commonly हम देखते हैं कि कभी exam stress आ जाता है या फिर stage fright आ जाता है, तो we have this butterflies in the stomach, किसी किसी को
Mhm.
headaches आता है, vomiting आता है, and all of that. So that's an indication of something that is happening inside your body जो physically आपके body में दिख जाता है. Yeah, thanks, Sheetal. So, I also want to tell our viewers here, the audience here, that we
Mhm.
will be having a question and answer session after this conversation. So, you can feel free to put in your questions in the chat box or even raise your hands after the session and just speak after this. So,
Yeah.
park your questions there, and we'll be happy to address as much as we can. And if you have any, if you think your questions are confidential that needs to be addressed, we'll be putting in our email ID as well. So you can just post in your question there if you wanted to remain confidential. Yes? Okay. Thank you all for being here. So yeah, we'll continue with our conversation here, Sheetal. So you said, how mental health is as important as physical health. तो एक है कि जब फिजिकली हमें कुछ होता है, राइट, फॉर एग्जांपल इफ आई हैव अ फीवर, आई विल गो
Mhm.
एंड विजिट द जनरल फिजिशियन, राइट. लेकिन मेंटली कुछ होता है तो पीपल, लॉट ऑफ पीपल हैव अ कंफ्यूजन, मतलब मैं किसको अप्रोच करूं, किसके पास जाना चाहिए. तो यू वांट टू से समथिंग अबाउट दैट?
Yeah, actually, so many movies also confuse the people in this way. So, okay, I will give a clear explanation here. So, yeah, so just like we visit MBBS or medical doctor or any specialist for cardio or gynec issues, we'll go to
Right.
physiological doctors.
Mm.
But same as it is, the specialists are there in the mental health experts also.
Yes.
For example,
Both of us
psychologist,
here.
it's
Yeah.
me,
Go ahead.
and psychotherapist, it's you.
Yeah.
And we also have a psychiatrist in our hospital available.
Yeah. Yeah.
So these three are the mental health experts, which
Counselors as
we,
well. Like
yeah,
two. Yeah.
okay.
Four.
Okay.
Carry
So
on. I won't interrupt.
it's okay, it's okay. So these people are there to, if you want to have any issues and if you want to get attention on your mental health issues, so you can visit them. But there is also confusion in this. I'll go down slow. First of all, let's see how psychiatrist is. So, education wise, psychiatrist holds MBBS degree and they do a specialization in psychiatry. Okay. So, and whereas psychologists and psychotherapists, these both are who does masters also, and if they want to upgrade their education qualification, they do PhD and some diploma courses also, which is available, and they act they give the what do you say, They give the necessary treatment according to the diagnosis. See, because every person is different and unique. So according to their unique personalities, they give the treatment. But uh, what do you say? The psychotherapist and psychologist doesn't advise medicines. Only psychiatrists give treatment and they prescribe medicines. Okay.
Important.
And
Yeah.
now coming to the treatment style. As I said, psychotherapists, counselors, and psychologists, they make it planned psychotherapy and counseling sessions, and in that, which includes the therapy activities, exercises. Just like they suggest, sometimes they suggest yoga, but how you should do yoga, they'll suggest that. So
Guide
they
you.
don't just say,
Guide
okay,
you.
you have to do yoga or you have to do gym, but it doesn't
Right.
suit for every person. So it has
Right.
to go plan and step by step. First we have to see the diagnosis of the person, and we have to understand, okay, this person can give only 5 minutes for the yoga, this person can give 40 minutes for yoga, or this person can do the gym. So if a child come and we say, oh, you have to go to gym, then that doesn't make sense, right?
Mm-hmm.
So
Mm-hmm.
so these psychotherapists or counselors or whoever are there, they are trained in that, and they do suggest whatever is uh, right to the
Necessary.
person.
Yeah.
And coming to the psychiatrist, as I said, they prescribe medications,
Mm-hmm.
and they do give some psycho education to follow the medicines properly.
Yeah.
मतलब किसी किसी को होता है कि या भाई मैं अगर मैं ये मेडिसिन लिया तो मुझे इसकी आदत लग
Side effect.
जाएगी, या नहीं
Yeah.
तो मुझे बहुत नींद आ जाएगी, या नहीं तो
Mm-hmm.
मैं इसको अडिक्ट हो जाऊंगा, आई कैन नॉट कम आउट फ्रॉम दिस, आई कैन नॉट ओवरकम फ्रॉम दिस। ऐसा कुछ प्रॉब्लम होता है तो साइकियाट्रिस्ट दो psycho educate to them, and after that they refer to the psychologist for the psychotherapy services, because they psychologist and psychiatrist go hand in hand, they have to work together. So
Mm-hmm.
the person have to need to visit together.
Yes. Yeah.
So now the focus of area of the both are like I think it's almost clear what is psychologist and what is psychotherapist and what is counselor.
Mm-hmm.
So psychologist, psychotherapist do more focus on the emotional well-being, thinking style, and how do they prepare their lifestyle and how to change the lifestyle.
Mm-hmm.
And psychiatrists focus on the biological aspect because they are medical doctors. मैं एक
Yeah.
सिंपल एग्जांपल बताऊंगी, थोड़ा सा
Mm.
और क्लियर हो जाएगा. So let's understand that our brain is a computer. Okay, computer is also works
Yeah.
like a brain. So our brain is a computer. So
Mm.
psychologists or psychotherapists are the one who work on the software programming problems, right? And psychiatrists are the one who look into the hardware.
Okay. Yeah. That's a good way to put that. Okay. Yes.
Okay, I would like to share a case history here.
Yeah. Go on.
Uh, it's okay. Let's imagine that there is a man who is working in the company, and this ex-man has promoted as a team leader. तो
Mm-hmm.
टीम लीडर होते ही क्या होता है, तो वर्कलोड ज्यादा हो जाती है, एंड
Pressure
द
and
बॉस गिव द डेडलाइंस दैट यू हैव टू मीट. एंड
mm-hmm.
अगर टीम लीडर हुआ तो टीम मेंबर सबको आपको लाइक नो लीड करना पड़ता है.
Mm-hmm.
So, no, some team members, I mean, often all the members doesn't work in the same way. So
Mm-hmm.
they do have some up and downs in the members, and like अगर टीम लीडर सडनली हो गए तो उनको सबको अंडरस्टैंड करना पड़ता है कि इसको ये वर्क की पसंद है, इसको ये वर्क की देना चाहिए, ऐसा. सो ऐसा अगर suddenly if you get the promotion and if you are a leader, so it's natural that you will get develop stress issues, or sometimes you will get headaches, दैट ओके डेडलाइन आ रहा है लेकिन हमारा टीम मेंबर्स वर्क नहीं कर रहा है, तो मैं क्या करूं, उनके साथ कैसे इंटरेक्ट हो जाऊं, ये सब हो जाता है. एंड यू विल गेट स्ट्रेस इश्यूज एंड यू विल गेट हेडेक्स, लॉट ऑफ हेडेक्स. एंड आफ्टर दैट, ये हेडेक्स के, अगर आप वो जस्ट इमेजिन दैट यू आर इन स्ट्रेस एंड यू आर इन lot of things going on in your head and you're doing overthinking. So it
हम्म,
is natural that when you communicate with your friends or family members or with anyone, how will you interact? You'll
गुस्सा
burst
आ
out,
जाती है।
you will show your anger, and
हम्म,
sometimes you'll lose yourself,
हम्म,
right? And अगर ऐसा हुआ तो क्या हो जाता है, मतलब तब तक आपका रिलेशन एक था, एक बॉन्डिंग था, वो टूट जाएगा.
हम्म,
It's and because of your rude behavior, because your angriness and frustration in your head, just like I said, it reflects in your physiological body, then
हम्म,
your behavior completely changes.
right,
When your behavior completely changes, your bonding will also break up.
हम्म,
When you don't have any bondings around you, then you will become a lonely. So
आइसोलेट हो जाता है।
yes, isolate हो जाता है. And your stress, your headaches creates procrastination problems, deadlines create anxiety issues, and because of loneliness your sleep definitely get disturbed, and all this will connect into your depression stage.
हम्म,
So now, uh, imagine the stress issues and the headaches as a stage 1,
पहले
and when you become lonely, that's a stage 2.
तो
If you are in this stage 1 or stage 2,
हम्म,
if you visit a mental health expert, and if you reach out, you will
हम्म,
definitely get help, and the problem will solve at the initial
वहीं
stage.
पे बंद हो जाएगा या।
हाँ, वहीं पे बंद हो जाएगा. एंड इफ यू नेग्लेक्ट दैट, ओके ये हो गया तो डेडलाइन हो गया तो मैं कंप्लीट फ्री हो जाऊंगा, ये वर्क हो गया तो मैं कंप्लीट फ्री हो जाऊंगा, थोड़ी देर के बाद वो लोग समझ जाएंगे.
कीप
ऐसा
सप्रेसिंग
अगर
इट
आप,
ना।
हाँ, या दिस प्रोक्रेस्टिनेट कम्स आफ्टर द स्टेज 2. सो या प्रोक्रेस्टिनेट करते 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 आप जब डिप्रेशन स्टेज में हो जाते हो, व्हेन दैट इज अ स्टेज 3. एंड
हम्म,
हियर you have to visit psychiatrist and the psychotherapist and the psychologist, all three, all counseling, and it's etc etc etc.
मतलब ट्रीटमेंट बढ़ जाता है उसमें।
Yeah.
ओके या, राइट। Thanks, Sheetal, for that example. I hope it's clear to our participants here. And so what Sheetal shared is, हम जब तो मैं for people who came a bit later, so I had asked a question to Sheetal कि मतलब जब मेंटल मतलब फिजिकली कुछ होता है हमें तो हम डॉक्टर के पास जाते हैं, फिजिशियंस को मिलते हैं, बट मेंटली कुछ प्रॉब्लम्स होता है व्हेन वी फील मेंटली अनवेल, whom do we go to? लाइक अब अगर एक पैनिक अटैक आ गया, अदरवाइज यू फील कि यू आर डिप्रेस्ड, whom do you approach, right? So she was saying about the different mental health experts, right? There are counselors who see you at the basic level. मतलब जब भी आपको कुछ होता है initially, so you go to a counselor, a psychotherapist. तो वो लोग आपको they have guidelines for counseling, थोड़ा techniques use करते हैं, and then psychologists use more of psychological assessments and their evidence-based treatment plans in their counseling. And then we have psychiatrists who are medical doctors who prescribe medicines and psychoeducate the patients. तो साइकियाट्रिस्ट रेफरल के साथ हम उनको काउंसलिंग का भी बोलते हैं, बिकॉज वी अंडरस्टैंड दैट it needs to happen hand in hand, taking medicines as well as taking counseling, right? So another important aspect that Sheetal said here was that psychologists and psychotherapists cannot prescribe medicines. It's only the psychiatrist who has an MBBS degree who prescribes medicines. So
Yeah.
psychologists, psychiatrists, counselors, they do talk therapy. We'll talk more about talk therapy later. तो सो फॉर एग्जाम्पल मैं अभी हमारे अशोकन हॉस्पिटल में जो होता है वो मैं बताती हूँ. तो लॉट ऑफ टाइम्स um, because people do not know whom to approach when they have a mental health issue. As Sheetal had explained very well कि जो हमें physiologically जो symptoms आ जाता है, when you are stressed you may have a tummy upset, you may have bowels, irritable bowel syndrome, या फिर headaches आता है, vomiting आता है. So हम जनरली देखते हैं तो हम किसके पास जाते हैं, एक डॉक्टर को ही मिलते हैं, बिकॉज यू आर सीइंग सम सिम्टम्स इन योर फिजिकल बॉडी, राइट. सो यू आर स्टिल नॉट अवेयर कि आपको एक मेंटल हेल्थ प्रॉब्लम है. सो वी यूजुअली कॉमनली पीपल गो टू अ डॉक्टर. Okay, so here we even in the Raahat, the Raahat team, we have a family medicine physician, family physician who initially looks at these people who come with these symptoms. And हमारा यहाँ पे एक integrated medical treatment approach होता है, because we understand that so the doctor will understand that this is not just a physical problem but a mental health problem. तो वो हमें refer करते हैं to the counselors, and the counselors or the psychotherapists, they do an assessment, and when they feel ki they are okay to just go with counseling, they do it. Or else if they feel ki they need a specialist reference, someone who may be doing, like now Sheetal does hypnotherapy. So if we feel ki the person has sleep issues and need more help with that, we may refer the person to Sheetal or another clinical psychologist. And then if we feel that they need medication, like how Sheetal explained that example जहाँ पे वो third stage पे गए हैं, जहाँ पे उनको both you need both psychiatrist help and the psychologist help. तो हम ऐसे accordingly we refer. So at Raahat we work as a team. It's a integrated approach, and um, we work in coordination. Right, so इसलिए हम बोलते हैं कि we have this whole person care concept, where we understand that our body, we cannot segregate our parts. मतलब when you have something happening in your body, it has an effect on your mental health. So we work in a holistic approach, right? Yeah. So to move on, Sheetal, you
Okay.
spoke about the different mental health experts and how their approaches are different, right? Can you
Yeah.
go a little more deeper and tell people about what happens in each thing, like counseling में क्या है, psychotherapy में क्या होता है? You wanna share that?
Okay.
Yeah.
So counseling sessions is happens in very at initial stage. जब
Mm-hmm.
फर्स्ट एंड सेकंड सेशंस में होता है, मोस्टली वहाँ पे काउंसलिंग सेशंस ही होता है. So counseling sessions just focus on personal or social or emotional challenges which are at present level, and they help to
Current
improve,
issues जो होते हैं.
yeah, the current issues.
Mm.
And they help to improve the first of all relationship, and first of all their confidence level, because they do have very low confidence levels when they come to us. So first we work on the confidence levels, etc. And mostly only talk therapy happens in these sessions based on the client's requirements.
Mm.
So when it comes to psychotherapy, this is which is also counseling, the same talk therapy, but in intensive level. We focus a lot in the individual lifestyle, family, couple. If there is any couple coming to us, like
Mm.
like they have any issues between both of the couples, husband and wife,
Yeah.
they between the husband and wife. So we go into the intensive level, we check in their life background and all that, and then we plan a sessions, like, okay, including activities, assessments, and exercises which they can do, and we give some homework that they should follow it.
Right.
So coming to the psychological assessments. Psychological
Yeah.
assessments, most of the people don't know about the psychological assessment, because
Right.
psychological assessments are very rare, and only clinical psychologists or rehabilitation psychologists have the eligibility to do the psychological
Right.
assessments.
Mm-hmm.
So psychological assessments are also just like how we have a blood test, X-rays, scannings in the physiological level. So same
Mm-hmm.
as that, in the psychological level, we do have anxiety level to check anxiety level, to check depression level, and to check personality level, and locus of control, and whatever
Hmm.
on the individual's cognitive, emotional, and behavioral functions. We do
Yeah.
assess that.
Okay.
Uh, okay, let me make it more clear. For example, if there is a
Yes.
student and she's not studying well, and she have to appear for a competitive exams, and she's struggling a lot to give the exam. Even she's good at verbal way, not at the written way. Verbal way, she's really good. So her teacher complains that कि ये बोलती अच्छी है लेकिन लिखती कुछ नहीं है, and she have to understand the questions and understand the no, competitive exam में question एक सीधा नहीं देते हैं ना, उल्टा उल्टा करके देते हैं. So we have to understand the questions, how
So
they
like
are
it's
asking.
lost in between.
हाँ, how they are asking. So we have to understand, and then we have to answer the question. So it's a
Hmm.
difficult level to understand. मतलब यहाँ पे reasoning ability बहुत जरूरी होती है. So if suppose if the student comes to us, what we do is, first of all, we do the psychological assessment on her, and we try to understand if there is any learning disability,
Mm-hmm.
if there is any ADHD issues, that's why she's rushing, or if there is any writing problem, if there is any fine motor problem in her.
Mm-hmm.
These we all check in the psychological assessment. And after
Okay.
that, psychotherapy session happens with the parents.
Hmm. Yeah. Right. Okay.
I think it's clear.
Yes, yes. Those are some great points, so especially the psychological assessments that people are not aware of, So to just tell you, audience, we have two clinical psychologists in our team, and they do psychological assessment here. And so, yeah, whenever you feel that there's a need, of course, you can always ask us. We'll also let you know what kind of assessments our team members here do, right? Um, yeah, there are new people joining in. I just welcome you all here. So we are discussing on mental health, the common questions we have on mental health. So we just finished discussing about the different mental health experts, psychologists, counselors, psychotherapists, and psychiatrists. And okay, right now we'll go to this talk therapy thing. We just discussed about talk therapy, and I said we'll discuss more on that. Sheetal, tell us, there's this um, common question about वाई टॉक थेरेपी. मैं तो अपने दोस्तों से बात कर सकता हूँ या फिर फैमिली मेंबर्स है, मैं तो वैसे भी बातचीत करता हूँ. सो व्हाई डू यू टॉक थेरेपी सेपरेटली, एंड व्हाई ये बात करने के लिए व्हाई डू यू हैव टू पे? दैट्स द कॉमन क्वेश्चन. सिर्फ बात करते हो तो इसके लिए पेमेंट भी लगे, मतलब ये क्या है? व्हाट इज दिस एक्सपर्ट थिंग अबाउट टॉक थेरेपी? I'm sure you would have also got this question. So,
Yes, yes.
what do you
Even
tell?
my
How do you
friends,
explain?
even my friend says that you are talking with us, बोलो तो क्या अभी थेरेपी हो जा रही है?
Yeah. Yeah. So, what do you tell how do you explain it to your patients or your friends, who ask this question to you?
Okay. So question in the question, I'm going to ask you the question again. So, how do the news media influence the public by communicating through TV news channels, newspapers, and social media? Is that right? ऐसे तो कम्युनिकेट करते हैं
Yeah.
ना, इन्फ्लुएंस करने के लिए पब्लिक को.
Yes, yes, yeah.
And
बात के बिना काम होता ही नहीं है. Right. Yeah.
journalists do that only.
Yes, yes, yeah.
उनका काम ही वही है. They check the level. If they are not good in talking skills,
Right,
then they won't get the job.
right, right.
And आपको याद है कि कोविड के टाइम में the
Mm-hmm.
PUBG was so popular.
Yeah.
Can you tell me why it
Pastime.
is? Because
I
they
know.
have the unique feature of interacting with the people.
Oh
You
yeah.
can
Okay.
interact and you can talk. ये यहाँ पे नहीं पीछे से आओ
Yeah.
कुछ
Okay.
भी
There's someone
in the
talking.
PUBG. Yeah.
Okay.
So
Okay.
because of that interactive feature, the PUBG
Mm-hmm.
got very popular so that the game was too much engaging. It was very
Right.
nice to do the time pass in the time.
Mm-hmm.
And आप क्रिकेट देखते हो?
I'm not a fan, but I know that there are people here who will be. Yeah.
Okay, it's okay. So what does the coach do before sending the cricket team to the field? Hmm?
Motivation देते हैं.
They do the
ये करो
motivational
ऐसा करो.
speech. Huh?
Yeah.
And have you the army? What does the
Mm-hmm.
commander do before they go into the battlefield? He does give the
Instruction.
motivational speech. मेरे को चलो हम इंडिया के लिए ये लड़ेंगे हमें वो करेंगे
Right.
हम ये करेंगे we have to save the India because we are the soldiers. This is how they talk and they motivate the soldiers. So
It's
they
like Josh
only
talks.
yeah because of only this motivational speech, just
Mm-hmm.
imagine soldiers forget about their family, friends, and everything. They just
Right.
go into the battlefield only for India army, and that happens influenced because of the motivation, because of the speech which the commander
The way
does.
they talk. Yeah.
This is also talking, right?
Yes. Yes.
And I'll give this. Suppose if anyone has lost their loved ones,
Mm-hmm.
एक गिफ्ट दिया तो हो जाता है
बाप
और
रे.
कुछ भेजे तो हो जाता है.
नहीं.
No, you have to go in person, you have to sit with them and you have to talk something with them. उसके बाद
Mm-hmm.
ही उनका ग्रीफ और उनका ट्रॉमा थोड़ा सा कम होती है.
I think the presence also plays an important role. Just being there for them also. मतलब
Yeah,
counseling में भी वही होता है ना, right? That's
yeah.
yeah.
And very silly one.
Mm.
If you are having any court case and your lawyer says मुझे बात करना नहीं आता है, how does you win the case?
वो लॉयर ही कैसे बना?
So
Yeah.
that's why we say words are sharper than a sword.
Yeah. Wow.
So
That's
I will
insightful.
say yes,
Yeah.
talking therapy plays a key role in the counseling sessions. Definitely talking do wonders just like a teacher helps a student to learn. And
Mm-hmm.
here we are also making our clients to learn to enjoy the life, to learn how to love themselves, to learn to make to make them confidence and guide them
Mm-hmm.
into their path whichever they like, to build their relations and everything.
Mm-hmm.
But yes, we do go under training just like the teachers.
Yes, yes. Oh, that's really insightful. I will take that home. When I get these questions, I'm gonna say all these examples and ask them back these questions. Yeah, yeah. So yes, when we say talk therapy, it's not just like talking to the friends. If we are, of course, trained. There is a skill in the talking that we do. There is reflective listening that we're doing. We're also when the client is speaking, आप जब सामने बैठ के बात करते हो तो हम we are also trying to kind of make connection with the cloud of thoughts you are coming to us with. मतलब जब भी patient the client आते हैं so they talk a lot from tips and bits from everywhere. So we have this job also to make connections and thoda to make sense of what you're trying to say. All of this takes skill, and we are there's a training that we go through to do this. So please हमें pay कर दीजिए. This is not just talking to your friends. We do get trained for this. Yeah.
Yeah, with
So
friends we talk like a friendly, but when
right,
we are
there's this
in our seat, we are a counselors there.
yeah.
That
There's a
talking is
therapeutic
different. This talking is different.
yeah, it's right. The dynamics of the relationship is also so different, that I mean, the therapeutic alliance that happens, मतलब एक अलग सा एक relationship होता है the counselor and the client के बीच में, which is not like your friends. मतलब friends से तो आप कभी भी रात में भी फोन करो तो उठा देते हैं. Counselors ऐसे नहीं होते हैं. We'll be available to you during the sessions, and only during emergencies we can take calls. ऐसा है. तो you know that helps you in that in the relationship, right? Thanks, Sheetal. Another very okay, this will be the last question, but something that
Okay.
people, the common people are very curious about is about the lives of counselors and psychologists. मतलब हम तो बोलते हैं कि हाँ, when we have anger issues and relationship issues, हम counselors के पास आते हैं. But as counselors ourselves, they people are curious कि हमें कभी issues आते हैं क्या? Do we go through relationship issues, anger issues? Do we experience stress? Do you wanna shed light on that too? That people are
Okay.
aware of how our lives are as psychologists, counselors, and psychotherapists.
Many a times, really. Even my family members do say this. मतलब कभी कभी मुझे गुस्सा आ जाते तो I'll do the shouting and they say, "Oh, come on, you're
You're
a
a counselor, you
psychologist.
can't do this.
You cannot
You're not
shout."
supposed to. Yeah. अरे हम भी इंसान है भाई. Yeah.
Okay. So
Hmm.
I say yes, yes, yes. We do experience anger. We are not a Buddha. We do get
Yeah.
upset. Do get stressed. And yes, sometimes we seek help from counselors ourselves. We do go to the counselors, and we do have therapy, and we do the activities whatever the counselors tell
Yes.
us to
Yes.
do.
Yes.
And we'll take very serious to do the homework also, so that we can heal ourselves very quickly, because we
Right.
also have a responsibility of our clients.
Right.
So actually, most of people get this also, like foreign country, वहाँ पे psychologists अलग होते हैं, India में psychologists अलग होते हैं,
Mm-hmm.
and they both are same, because
Definitely.
there are some foreign
Rules and
clients also
regulations.
who does say this also, like वहाँ पे तो
Mm.
हम कभी नहीं देखे हैं, बट इंडिया में तो कोई काउंसलर शाउट कर देते हमारे ऊपर भी, बट यस, एक्चुअली दैट्स अ रॉन्ग थिंग, shouting on the clients, it's very wrong thing, but हाँ, counselors को भी गुस्सा आता है, particularly in India, because here what happens, we often consider our workplaces, social gatherings, or any clubs, we if we are part of that, we say that, "Hey, I'm a member of this social club. I'm a member of this company. I'm a member of this, what do you say? What any uh, club or anything, any social gathering." No,
Mm-hmm.
you consider yourself like a part of the that club, and the club will become a family. In any social gatherings, in a church also, and in any temple also, we say we are your family. Come on, yeah, हम तुम्हारे family members जैसे, we become a part of family, because we have a tendency to live in a family oriented culture
Mm.
in India.
Right.
As simple I say, India is a family, family is India. So when
Okay.
even we get married to a any person, we just don't
Mm.
get married to a boy or girl, we
Right. You
get to
get married.
married to the family.
Right.
यहाँ पे मैरिज दो पर्सन के बीच में नहीं होता है ना,
Yes.
फैमिली के बीच
Yes.
में होता है. So when we are maintaining that relationships, we often express our emotions.
Mm-hmm.
When we are living close with our others, our
Mm-hmm.
feelings can overlap, our emotions can overlap sometimes. So that leads to anger or upset, or because sometimes we feel left out, even it is not real, we
Mm-hmm.
left out. So to
Yeah.
foster that healthy relationship, we have to maintain a good mental health.
Right.
So it is, I am not saying this is only for you. So we are also part in it. This
Yeah.
session is for us also.
Yes, Sheetal.
See, if we don't
Yeah,
travel the same way, we can't guide others, right?
right, right. Right. And if our cups are empty, we cannot fill other cups. And so we
Yes.
have to fill our cups first. मतलब हमारा healing तो हम it's an ongoing journey. We don't say कि हम पूरा perfectly healed है. It's an ongoing journey for us as well. And in that, when our cups are getting filled, we are also overflowing and helping other people. Right. So, all the audience here and people who will be watching this session afterward, you can be rest assured that we have also sat in that client ka chair pe, so we understand what you're going through and how it feels to be on the other side of the table and be a client and have those, questions about how therapy is going to look like. So, yeah. So Sheetal, in all of the everything that we talked about, the um, basic mental health aspects that we just unpacked, the common questions
Okay.
that we get as, uh, do you have any takeaway for our scholars here, for the audience here, about this topic?
So in the starting, as I said, that there are some symptoms that we should check ourselves and reach out to the mental health expert. So I would like to give some the most common signs which can say that you are mentally disturbed and you need to seek out for the help.
Mm-hmm.
So the first is coming. There's like first. If there is any loss of appetite or increase in appetite,
Yeah, both ways.
and yeah, both way. And the other is if there is any lack of interest or lack of focus, that once you in any
Used to.
activities that you used to once enjoy it,
Mm.
even it is like in household chores also, you used to keep your house very clean and nice and tidy, but uh, some from few days you are not able to do it and you have lose interest in that. That is also one symptom.
Mm-hmm.
And if you are experiencing any procrastination in your work life or in your personal life, आज नहीं कल जाएंगे, आज नहीं कल जाएंगे, ऐसा, even with your family members, that is also a sign. And if you notice any sleep disturbances, मतलब like you can say in insomnia and hypersomnia, मतलब ज्यादा सो रहे हो वो भी एक प्रॉब्लम हो जाती है, कम सो रहे हो वो भी एक प्रॉब्लम हो जाती है. That's also a sign. And if you are experiencing any mood swings, and it is affecting your relationships, and this is very common in men who are working, because most of the men don't have the freedom to talk, especially in India. यहाँ पे सब क्या बोलते हैं कि
मर्द को
आप
दर्द नहीं होता.
या तो वो क्यों भाई, वो भी तो इंसान ही है. They do
Yeah.
have emotions, they do have feelings, they do have a loss of loved ones or any grief going on in there. They also have to talk, they have to also speak out, but in India it is not allowed most of.
Mm.
So they experience very very mood swings, like they go work nicely, वर्क प्लेस में बहुत अच्छे रहते हैं, घर आते
Mm.
फट 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 फट, ये हो गया अगर बीवी ने कुछ भी बोल दिया तो उसके ऊपर चिल्लाना, बच्चे ऊपर बोले तो उसके ऊपर चिल्लाना. That's
Yeah.
also
ये तो बहुत
a mental
common है.
upset. Yeah, but that is a mental upset.
Yes, yes, truly.
Yeah. And if there is any sudden work, like boss ने कुछ कह दिया, that is actually routine work. But if you are feeling experiencing any vomiting like issue, just like I said in the initial,
Mm.
diarrhea or anything,
Mm-hmm.
then you have to consider, yeah, it's a mental health issue and you have to reach out. And for some, like we have experienced this lot in the COVID time. So many people have lost their loved ones, and there are so many people still have not overcome from that trauma. And if it is still impacting your daily life, then I should say that please acknowledge it immediately and seek help from any mental health professional. And one thing, the last, this is very common from a 2 years old to 80 plus. ऐसा
Hmm.
नहीं कि ओनली यंग अडल्ट को ही होता है, वो ऐसा नहीं कि वो जो ऑफिस जा रहे हैं उनको ही होता है. आई
Hmm.
हैव आई हैव 3 year 4 year old also who are having stress issues.
Sad. Hmm.
I have seen. So it's common from 2 years to 80 plus.
Because we're living in that age, no, very stressful environment we're living in. It's really sad that babies as young as 3 years have to go through this.
Yes.
Yeah.
What can we say?
Hmm. Right.
There are a
And
lot
I
of.
think yeah, the COVID itself has brought in so much of mental health issues because even after the pandemic, people are still struggling to adjust to the new situation that is. Even if let it be it work from home culture or the financial situation that people go through after the
Sudden loss of
pandemic.
jobs.
Yes, yes. So that is still something people are grappling with, and even with the old age population, I've seen people who who stopped going out after COVID, especially, and they've become immobile because they couldn't go out during the COVID times, and now they've got isolated in their homes. So that again brings the problem of loneliness and depression and all other mental health issues. Yeah. Thanks, Sheetal, for sharing on all these points. I suppose that that also answers brings more clarity to the first question that we asked about whom do we go to when we have a mental health issue. So it is also important to understand what a mental health issue is. For you to identify what what becomes a mental health issue. So things like these, what Sheetal shared now, the anxiety, the work stress, and which you see in your body. So, of course, we understand that whenever we see something in our bodies, we go to a doctor. But that's why we have an, you know, comprehensive approach to the whole body care, where when the doctors see the patients and they see that it's not just the the physical health, we have referrals here. We have the whole team to look into the issue. There are mental health counselors, psychologists, psychiatrists who treat the whole person, right? Yeah. That is really interesting, and I really enjoyed this conversation with you, Sheetal, because it's something that we kind of keep discussing about. The rage that we feel when we hear about all the misconceptions people have about mental health. And I remember how even you feel that, yeah, people still don't know. And I'm really happy that we're doing this and educating ourselves. It's a community that we have, and we're educating ourselves. And as I was remembering, there's this phrase, right? Ignorance is bliss. Ignorance is no more a bliss now because these things are happening. Mental health issue is something that is very prevalent, and we'll have to deal with it. It's time that we tackle with it, and to tackle it we need to be aware. We need to have the knowledge of what is mental health issue and how it can affect our daily life, right? Thank you, Sheetal, for that. So thanks for all joining here. So now so stay tuned to our social media handles, our Instagram page, our Facebook page, where we'll be putting up updates on the sessions which will be coming up. And even this session, we will be putting it up on our YouTube channel. So if you want to revisit it, or if you want to share the link with anyone, any of your family or friends who may benefit from hearing this, please go ahead and do that. And you will also find our other YouTube videos about the recent ones that we've done on mental health at workplace. We had a panel discussion earlier on Mental Health Day on October 10th. That is also available in our YouTube channel. Um, yes, thanks. I also wanted to add, we've in our Ashok and Ashokwan website, we also have a blog which is frequently answered questions on counseling and psychotherapy. You could also check out that. The link will be put up in the chat box as well. Yeah, so as I think counselors, psychotherapists, as the mental health experts, it's important that we are also sensitive the to the to the common people, as in the fact that the ignorance is not because not their fault, as in we've always lived in a stigma world, so that is why we also have are taking this effort to just share the knowledge that we've gained, the experiences, the lived experiences that we've had, and we want to just encourage everyone to take the help because we ourselves have have lived experience, and we know how it feels to be in that state of mental dilemma and mental ill health, and that is why we are so passionate about doing this. So do reach out to us whenever you feel the need to. Do not hesitate. We want to, keep this non-judgmental space open for people who really need help to reach out. Thank you so much to everyone who's joined the call. Thank you for taking time out from your busy schedules. I know it's festive season and you could have been doing
Yeah.
so many other things, but you've chosen to be here with us, engaging in this conversation with us. Thank you so much. Have a good day. Yes,
Thank you to Sharon also, Lavani, and the team behind this session. Thank you for giving this opportunity. It was good to talk, and
yeah,
it's necessary to talk.
exactly.
Thank you, everyone, whoever has joined here.
Yes, please fill the feedback form. The link is put in the chat box. It
Yeah.
will really be helpful for us to understand what we need to improve and also encourage us if you have any points of appreciation that the encouragement will help us to move forward. We would really appreciate you giving us some feedback. Thank you.